the other aspect that is happening more and more is this consultations, reporting, in spite of alerting our patients, communicating directly, is the WhatsApp and the online consultations that they insist. So, for example, if I were to share my experience with this online consultation, was these patients who were following up with me for a long time. And then she had this fever of 104 for the last 2 or 3 days. And I told her that I do not understand your case and you will have to see me offline. And she was just staying around 500 meters from my clinic. And when I refused to see her online, they got really angry at me and saying, how could you do this in an emergency? So how do we navigate these issues? Because they are not only legal issues, but even clinical issues. What is
See,
the safeguard?
in medical council, they've come out with telemedicine guidelines. And in
Okay.
telemedicine guidelines, they have said two things. First, telemedicine, whenever you do, there has to be explicit consent. If patient starts telemedicine, then there is no consent required. But if you start telemedicine, then you have to take consent. Just patient has to speak that I am okay with telemedicine consultation. That confirms as a consent. Second
Okay.
thing, they have said all the videos or audios you have to preserve as a
Oh,
record. That is second thing. Third thing,
okay.
they have said it is not for emergency. If there is emergency, you immediately shut down telemedicine and tell patient to go to a nearby RMP. So your case falls into that category. Telemedicine is not for that as far as this medical council, our allopathic council is concerned.
Yes, but I believe we can follow that.
That if there is no rule for you, at least you can show something which is similar. So,
Yes.
and the last thing, even in telemedicine, they have said if there is a need in a cool case, forget emergency, there is a need to examine the patient, you have to put proper diagnosis and then only treatment should be started. So, I cannot say as a defense, in a defense that since it was telemedicine, I could not diagnose. That is why I had given wrong treatment. That is
Yes.
not the correct statement from my side. Either I should be able to diagnose 100% or I insist the patient to come to me and to get it checked. So you cannot take telemedicine as a defense also, and you should record everything. You have to take patient's identity. You have to show your identity. Identity exchange is also required because who is consulting you online, you also don't know. So you have to take their identity proof. You have to give your identity proof, your consultation fees you have to declare, and you have to give prescription. Also give prescription in such a way which is in a JPEG format or something. That is what I recommend because there are cases where word format prescription was given and patient changed it. Like some psych
Okay.
drugs. Doctor has prescribed for 15 days and he made it 45 days because he had that addiction.
Correct.
So all these things can happen on online. So we have to be very, very careful. Also, I suggest that in prescription you write don't give this medicine if prescription is more than 15 days old. And I put the date. So if date is more than 15 days old, this prescription should not be honored. Like that, you have to put all these caveats in our prescriptions.